Okay, so if your client says, hey, Charlie, what if you got to try out this experimental treatment because we're seeing great results. It's saving people's lives. You need to try this experimental treatment out, right? Well, Medicare is not going to cover that experimental treatment. Medicare is not going to mess around with that. So who's going to help us pay for that? Who's going to help us pay for that experimental treatment that's going to save your life? Well, that's where a big fat check from a cancer policy would help us, right? Money from a cancer check would help us do the things that Medicare isn't gonna pay for us. It isn't gonna cover for us those experimental treatments. That's reason number one. Reason number two, what if the doctor says, hey, Charlie, I need you to pick up your whole life and I need you to move out to the MD Anderson Cancer Center down in Texas because they have the treatment that's going to save your life. Well, who's going to help Charlie pick up all his things, bring family members with him for support, and live out at the MD Anderson Cancer Center for the next month or two, right? Medicare is not going to do that. Although Medicare, when you get there, is going to take care of the bills, especially if you have a Medicare supplement, right? You don't have to worry about that. But no one's going to help them pick up their stuff, live out there for a month or two, get people out of work, get their kids out of work so that they can, come support them while they're going through some cancer treatment everywhere else. That's called displacement. People get displaced all the time. If you know family members that have gone through cancer, or you yourself, or have clients, they'll tell you all the time that we had to go here to get cancer treatments. Okay, so that's reason number two. Reason number three is a lot of these chemotherapy. Give me 1 second. Can you guys hear me okay? Can you hear me okay?
Yeah.
Okay.
Yeah.
So a lot of these chemotherapy treatments are going to oral chemo medications, where, let me plug this in, where they're popping pills, right? Taking some cancer medications that probably keep the cancer in remission or something like that, right? Even though we have a Part D prescription drug plan, those medications might still cost us an arm and a leg. It probably costs, $5,000, $6,000, $7,000 a year to be on those medications. And what if the doctor says you need to take those medications for the next 2 or 3 years, Charlie? Right? Who's going to help us pay for that? That's where a big fat check from a cancer policy would help us, right? The fourth and final reason why everybody should have a cancer policy, just because somebody goes through chemotherapy or surgery, cancer surgery, it doesn't mean that the very next day they're up and running at 100%, right? They still have to go through some recovery time, some rest time so that they can get stronger and back up to speed. It'll be nice to have some money to help us live the quality of life that we want to live while we're getting stronger and back up to speed, right? So those are the 4 reasons why everybody should have a cancer policy. So again, as I'm going through my spiel, I'm introducing them to Medicare. Okay, this is what option number 1 is. The red, white, and blue card does this, and it costs this. This is what a Medicare supplement does. It does this, it costs this, and this is what a Part D prescription drug plan costs, and this is what it does. And remember, Mr. Client, remember, Charlie, I told you at the beginning that Medicare doesn't cover the extra bells and whistles that people are looking for. So if you need a dental and vision policy, you have to budget for another $65 a month. Okay, so write that down. And the last and final thing that everybody should have, that everybody in your situation is getting, is a cancer policy. And here's why. So don't worry about the bills. If God forbid you got diagnosed with cancer, the bills are going to be taken care of by your Medicare supplement. All you got to do is pay $203, or they're going to be taken care of by your Medicare Advantage plan. All you got to do is pay the 20% until we hit that number, right? But what if the doctor says, hey, Charlie, I need you to try out this experimental treatment. We're seeing great results. It's saving people's lives. Who's going to help us pay for that, Charlie? Medicare is not going to mess around with that. They're going to say, hey, you're on your own. That's where a big fat check from a cancer policy would help us. Okay. Secondly, what if the doctor says, "Hey, Charlie, I need you to pick up all your stuff and I need you to go to the Mayo Clinic out in Minnesota because they got the treatment that's going to save your life." When you get there, Charlie, don't worry, your Medicare supplement will take care of it. Or if your Medicare Advantage plan is part of the Mayo Clinic, all you got to do is pay your 20%. But who's going to help you pick up all your life, pick up all your things, take some family members with you, get them out of work, and live out there at the Mayo Clinic for the next month or two, right? Medicare is not going to help us do that. That's called displacement. People get displaced all the time. People have to go through treatments here and there to get cancer treatments, okay? That's where a big fat check from a cancer policy would help us. And then what if the doctor says, here, a lot of these chemo treatments are going to oral chemo medications. So even though we have a drug plan that we talked about, the medications that you're taking for cancer may still cost you $5,000, $6,000, $7,000 a year. And if the doctor says, I need you to take this medication for the next 2 or 3 years, who's going to help us pay for that? Again, that's where a big fat check from a cancer policy would help us. And lastly, God forbid you got to go through this stuff, but if you've heard people that go through chemo or go through cancer surgeries, it's not like they're back up and running a marathon the very next day. They have to go through recovery. They have to rest. They have to, get stronger over time. Some money would help us live the quality of life that we need to live to get us stronger. That's why everybody needs a cancer policy. Okay. So every time I'm always presenting the cancer policies to all my clients. All my clients, I also tell them, like, I'm not the pushy type. I also tell them, listen, man, all this stuff is optional, right? You don't have to do anything you don't want to do. Everything we talk about is optional. But most people in your situation are going with this gold standard of Medicare, right? When you say stuff like that, like people in your situation, it makes them feel like, oh, wait, this is my situation and I should be going with this stuff, right? It's like a psychology thing. Most people in your situation, yes, this is my situation. I should be going with this stuff, right? So anybody here sell the cancer policies as well? Anybody ever do that stuff? No? Man, I'm presenting them to everybody and I'm probably selling like 30, 40% of them, There's not all of them that grab it, but 30, 40% of them are grabbing it, are getting it. Okay. Anybody have any questions about it at all?
Are they super expensive or
No, let me
how
show you.
expensive are they?
So when somebody's turning 65, I'm always telling them that it's about $19 a month for a $10,000 cancer policy. And for a $30,000 cancer policy, we're looking at about 55 or $60 a month, right? So let's take a look. I'm going to show you how to quote it. I'm going to share my screen. My go-to for cancer policies is always Mutual of Omaha. Okay, you guys might have somebody else. You guys might have somebody like Aetna or somebody that you have a go-to. Either way, always present them no matter which one you use. But Mutual of Omaha is the one that I've been using lately. So let me show you guys.
So the cost, I was going to say, the cost is pretty similar to like a final expense plan, pretty much. They run about that.
So I'm the first one to admit that I don't do a lot of final expense policies, but that's about right. So we go to Mutual of Omaha. Electronic applications. And I'm doing this in front of the clients. I'm always doing a screen share with my clients and they're seeing everything that I'm doing, right? So if you guys aren't doing screen shares, then I feel sorry for you because I sell a lot of policies when they can like look at me in my eye and they can tell that I'm not, blowing smoke up their butt and what I'm talking about is true, right? And as I'm going through quotes, I don't care if they see other carriers on there. I'm confident to say, listen, this is the one we need to go with because we've had great experience with them. They're affordable, they're popular, have a lot of people on the books or whatever the case may be, right? So I'm just gonna pick a state, individual. I'm usually talking to folks that are 64 years old, going on 65, right? A $30,000 cancer policy is gonna cost us $58 a month, right? I always start high. And then if they want to do the most affordable one, it's $19 a month. So always give them that, always give them the option. Always present it. I remember when I first started selling insurance, I jumped in during ACA times, right? And all I was doing was selling nothing but ACA policies, ACA policies, ACA policies. And I never offered any of the extra stuff. I never offered dental, vision, and hearing or accident policies, anything like that, right? I just started doing it and I started selling more policies, right? I just started adding it to my repertoire, okay? I started saying like, okay, everybody wants a dental policy because that goes along with health insurance, and this is how much it's going to cost. And I started selling more dental policies, right? If you want the gold standard in Medicare, like most people are going with, you have to have a cancer policy. If you're confident in the policy, if you're confident in presenting it, then people are going to buy it from you. No problem. They trust you. They don't know what's good for them. You need to tell, like, they need somebody to tell them what's good for them, right? Yes.
Is any underwriting process needed?
Yeah, so we have to answer some medical questions, right? And they look into the medical records and they decide whether or not they can get the policy, you know? But usually between like 64.5 and 65.5 is guaranteed issued, usually. I don't think I've ever had one cancer policy not go through, if I'm not mistaken.
So
But
Carlos,
but it's easy money. A $19 policy may pay you an extra, I don't know, $200 a year or $300 a year. I don't even know what the commission is, honestly.
so
Rich, you-
Carlos,
yeah,
so you present this to both if they're on Med Sup plan or Medicare Advantage, no matter what, correct?
100%.
Okay,
100%.
so question for you on the Medicare Advantage. Obviously, we all know there's holes. You've got the first 6, 7. Did you go into any of that in terms of the hospital indemnity or anything like that on top of the cancer?
No, I don't. I usually try to keep it to the dental and vision and the cancer policy.
Okay,
I'm the last one to go to it about the hip policies. I just don't sell a lot of them, you know.
okay,
Maybe one of you guys that does sell a bunch of them, we can get on another training next week and we can talk about how
okay.
to present them, but I don't.
Thank you.
I'm just more comfortable or confident in selling the cancer policies, but you know, I need to do it as well. I need to get my script in place for the hip stuff, and then I should just do it.
Okay.
But I'm presenting the cancer policy to both, right? Because the cancer policy applies to both.
I appreciate that. Thank you.
So
How to qualify for the benefit?
what do you mean, how do you qualify?
Like, once you get to the diagnostic notice from hospital, then you can qualify for this policy?
That's correct. So if you get diagnosed with a critical cancer, then they're just gonna give you a check.
So any cancer, right? So
It has
doesn't,
to be not any cancer. It has to be like a critical cancer. Like you can't have melanoma of the skin and it's cancerous and then all of a sudden get a $30,000 check. You know, it has to be some sort of critical cancer. I have yet to experience somebody get diagnosed and have to use the policy, but that's what I was told by Mutual of Omaha. So again, 4 reasons. Experimental displacement, cost of cancer medications, and then, you know, recovery. Everybody wouldn't be mad if they have cash while they're going through some recovery, right?
Carlos, you don't sell it to people who are Medicare Advantage with extra help, right? Or have you been successful doing that too?
Medicare Advantage with extra help, I do. Extra help, you mean, extra help is just
Medicaid,
no, extra help, remember, is just the
LIS.
help for the medications,
Mhm,
right? But for the Medicare Savings Program, I'm always gonna present it no matter what, right? But likely they don't have the cash to afford something like that. But
Okay.
those folks, the rules still apply, right?
Right.
We know that some things aren't going to be covered by the Medicare Advantage plans, right? Sometimes the doctors are going to want you to do stuff that, you know, are just not going to be allowed with your Medicare Advantage plan. Experimental treatments or actual treatments that they don't want to cover for whatever reason. And then we can go back to displacement. A Medicare Advantage plan is limited to a network, right? And what if they say you need to go out here to get your treatment? Number one, Medicare Advantage is not going to allow you to do that. So if you really need to do it, cash is going to help you do it. Forget about the Medicare Advantage plan. Cash is going to help you get the stuff that you need to get done. And same thing with the medications, right? Medications are going to cost us a lot of money. And then recovery, everybody needs that money to recover. So I always present it with both.
What's the range of commissions that you receive from $10,000 to $30,000 policy?
I think I get 60%. I think I get 60%. So anybody underneath me would probably get less than that, but I couldn't tell you what it is. I'd have to find out for you guys. You know, but full transparency, I think I get 60.
Carlos,
Yeah,
usually do you add the heart attack and stroke rider or no?
it just gets a little bit more expensive with the heart attack and stroke rider, but you do whatever you want. Right? I usually
Can you
don't.
click that to see how
Yeah.
much it will be?
Yeah, hold on.
Wow, much more.
Mm-hmm.
Oh, because that's a 30,000, maybe amount you can change to 10,000.
Yep. $35, which
Okay,
is
double.
which isn't bad either.
Mhm.
So practice the script, right? I'm gonna send you guys the script. I'm also gonna send you some recordings of me presenting it to some clients. That way you guys can listen to it. Okay. But I present it to everybody. Okay.
So about how long you can get approved for the policy?
It's usually almost right away. Yeah.
Already?
Yeah, probably a day or two, you'll get the notice from Mutual of Omaha saying that the policy was issued. And by the way, we can't choose effective dates with Mutual of Omaha. We can't say we want to start this policy, September 1st. When we do the application, as soon as it's approved, that's when the policy is going to start.
So that's no like the company will interview the client. That will you just we ask some questions, they answer, then they check the
Correct. They look into the
ID or
medical
whatever,
record.
right?
Yep, they check the medical records and then they get to decide whether or not they want to do it. But like I said, if you're working 64 and a half to 65 and a half, guaranteed no problem.
Okay, great.
There is a 30-day waiting period to get cancer. Like you can't get the policy and then in the next 30 days get diagnosed with cancer and expect the policy to pay out. There is a 30-day waiting period. Right?
Carlos,
And obviously they're not going to cover you if you already got diagnosed with cancer, you know?
Carlos.
Yeah.
I jump in a little late. So when you present these policies, like when you throw the hook, like in the middle of the presentation, and you give a little hint, or you wait all the way to the end to throw it out?
I'm showing the whole chain at first. I'm telling them what to expect at the very beginning. So at the very
Okay.
beginning of the presentation, I'm letting them know, listen, I'm going to give you a 30,000-foot overview of what Medicare is all about and give you your two primary options, right? And then I get into, I tell them, listen, option number one, this is what it is. And it let me tell you, I pull up this PowerPoint, right? Give me 1 second. I have this PowerPoint and I have the Medicare and You guidebook pulled up,
Okay.
and I flip flop from both of those, and I'll show you where I start. we obviously use this presentation for educational seminars and stuff like that, but I go straight here. So I say, okay, Mr. Client, let's start here. Okay, this is what we call the original Medicare. This is the red, white, and blue card. Comes with Part A, Part B. I go over the spiel, blah blah. Everybody knows that this covers 80% of all the doctor and hospital bills. So the question that everybody always asks us is, who's going to help us cover the other 20%? Who's going to help us cover medications, because it doesn't cover medications, and here's where I get them. And who's going to help us all the other stuff that people in your situation are looking for? Who's going to help us cover all the stuff that we lose when we leave the job or when we retire? That's the dental, vision, hearing, cancer policies, life insurance, all that stuff. And then this is where we come in, Mr. Client. This is where we come in and we show you how to fill the gaps. So they're already prepared. They're already prepared
Gotcha.
for me to knock them out.
Gotcha.
So again, I go here. So this is where we start. This is the red, white, and blue card. Comes in Part A, Part B. I go over that, how much it all costs, what it all does, blah, blah, blah. So the question that
Gotcha.
everybody always asks is, who's going to help us cover the other 20%? Who's going to help us cover the medications? And who's going to help us cover all that stuff that we lose when we're retiring, or all those extra bells and whistles that people are looking for, like dental, vision, hearing, cancer policies, and life insurance.
And then you go on, finish the presentation.
And then bam, bam.
Then at the end.
I
Okay. Okay.
I
Yeah,
go
okay.
here,
That's yeah. Sounds good. All right. Sounds good.
Medicare and You
Perfect.
2021, and then I start. I say, okay, have you received this Medicare and You guidebook yet? It's, you know, the holy Bible of Medicare. You can learn a lot of stuff about Medicare in here, but I'm just gonna direct you to some important pages. Let's go to page number 6 first. This is option number 1, blah, blah, blah. And then we go here, and then again, once I get them the Medicare supplement quote, once I get them the Part D quote, then I say, remember, this doesn't do all this. This doesn't cover all the stuff that we're looking for as well. The extra bells and whistles and the stuff that we lose from retirement. So if you want a dental or vision policy, you got to budget for another $65 a month. And then everybody needs a cancer policy. A $30,000 cancer policy is probably going to cost you $55 to $60 a month. Write that down. Now, here's why everybody in your situation needs a cancer policy. And then I go over those reasons.
Carlos,
Perfect.
do you do the quoting right away during the education seminar?
I use my PowerPoint as a visual to do the presentation. I do. Yes.
Yeah,
Is that
for
what
the
you-
quoting, I mean, for the quoting part.
I'm quoting as we're talking, right?
Oh,
So, for example, I'll have my Radius Bob up. Where did I go? Get my Radius Bob up.
Can you share the presentation with us? I would like a copy of it.
The PowerPoint, yeah.
Yeah, the PowerPoint,
Yeah, I'll give it to you.
Yeah.
Again, I don't use this whole presentation in this field. I'm really just,
Yeah, no.
I'm just really opening it up for show, like so they can see, oh, dang, this guy does Medicare seminars and he's got it all down, you know? And I'm really directing them to this page so they can see what the red, white, and blue card looks like, and they see Part A and B, and I explain this stuff. And then I go here every once in a while. I'll show them what the Part B deductible is, because I'm selling them usually a Plan G Medicare supplement, right? And then, you know, maybe I show this $148.50 premium. Those are usually the 3 slides that I'm using in this whole just dog and pony show, you know? But then I am using this one. I'm using this Medicare and You guidebook because everybody usually gets this and they have it in hand and they say, oh, damn, yeah, I have it. I have that one too. And sometimes they pull it out and they can have it in front of them. It feels good to them, you know? But I'm not going through this whole thing. I'm just going to page number 6 so they can see what Medicare is telling you. I'm not telling you that there's 2 primary options, but Medicare is telling you that you have 2 primary options. And this is option number 1, and this is option number 2, and this is what it all entails, right? When I get to my Medicare supplement, I go, oops. I go on page 71. They start talking to us about Medicare supplements, Medigap policies. And right here, they say that all Medigap policies are standardized. So these are the only 2 pages that I use, the 6 and 71. Again, it's just for show, right? But it's visual. It's good for the client to see that this is legit, that this is coming from CMS, and that what I'm talking about is not just a smoke. Does that make sense? Questions about this stuff? Anybody?
So you, looks like you more oriented to supplement.
No. I'm just going through the whole presentation, right? I'm showing them their two options, and I just start off with option number one, which is the Medigap policy. But I'll definitely say, so what I say is, okay. Well, let me do the presentation really quick. I'll just show you how I do it. Okay. So I'm going to give you a 30,000-foot overview of what Medicare is all about. Okay, so you see my screen. Okay, fantastic. Right. So let's start off here. This is what we call original Medicare. This is the red, white, and blue card. Right. It comes in two parts, Part A and Part B. Part A is hospital insurance. If you were formally admitted into the hospital, all the bills from the hospital would be ran through Medicare Part A. Okay. All the other bills we can think about is going to be ran through Medicare Part B. So if the doctor walks into the room, he has a bill. If you go to facilities outside of the hospital, like your doctor's office, the laboratory, anything outside of the hospital is going to be ran through Medicare Part B. Medicare Part A usually doesn't cost you anything. You've worked here all your life, you've paid into FICA taxes, you've earned your Medicare credits, and Medicare will give us Part A, what they call premium free, no charge, right? But everybody and their mama has to pay a standard premium for Part B. And that standard premium is $148.50, okay? If you're collecting Social Security, they're gonna automatically take that out of your Social Security check. If you're not collecting Social Security, then number one, we have to enroll you into Medicare because they're not gonna enroll you automatically. And then they're gonna send you a bill quarterly. So every 3 months, they're gonna send you a bill for $148.50 times 3. So you have to be prepared for that. Then I get into a little bit about, you know, if they want to set up automatic payments through Pay Easy, all that jazz. Okay. So we get through this, and I finished explaining Part A and Part B, and I say, okay, so everybody knows. I say everybody knows because everybody means them. Like they should know this stuff, right? So yeah, I know this stuff too, right? So everybody knows that this red, white, and blue card only covers about 80% of all the doctor and hospital bills. So the question that everybody always asks us, Charlie, is who's going to help us cover the other 20%? Who's going to help us cover the medications, because the red, white, and blue card doesn't cover the medications? And who's going to help us cover all the extra stuff that people are looking for when they finally retire, like dental, vision, hearing, cancer policies, life insurance policies, all that stuff? So this is where we come in. As insurance brokers, we help you fill in those gaps, okay? So have you received this Medicare and You guidebook by chance in the mail? Some people say yes, no, blah, blah. Okay, well, I'll send you a copy of it if you haven't. If you have, listen, it's 124 pages long. If you read the whole thing, you'll probably be the first one to read it, but I'm just gonna take you to some important pages, okay? So on page number 6, here's where they say, hey, Charlie, you have 2 primary Medicare options. You can go with option number 1 on the left-hand side or option number 2 on the right-hand side, okay? Option number 1 consists of walking around with 3 insurance cards, okay? The first card is the red, white, and blue card that we already talked about. Covers 80%, it's gonna cost us about $148 a month. Card number 2 is what we call a Medicare supplement, also known as a Medigap policy. This is the one that's gonna cover the other 20% that the red, white, and blue card doesn't cover. And then card number 3 is our Part B prescription drug plan. This is the card that's gonna help us cover, this is the card that we're gonna show at the pharmacy when we need to pick up some medications, okay? So what I'm gonna do, Charlie, is I'm gonna give you the quote for your Medicare supplement, your Part D prescription drug plan. I'm gonna tell you how it all works together with your red, white, and blue card. Then we're gonna put it off to the side. We're gonna forget about it, And we're gonna talk about option number 2, which is called a Medicare Advantage, also known as Part C. Okay? And then that's where I get into the Medicare supplement, right? I'm pulling up the Medicare supplement quotes. I make sure I gather, okay, give me some basic information. Tell me city, state, and zip code that you live in. Okay, what county? Okay, perfect. Let's jump into the quoting tool for our Medicare supplements. I go here. Everybody has access to this CSG quoting tool from Premier. And they're watching me do all this stuff. I don't care what they see because I have nothing to hide, right? I'm going here, 60133, whatever zip code. I'm picking the county, male or female, last time we checked. And sometimes they laugh, sometimes they don't, you know? And then I go here, right? Well, I go here first. I say, okay, so your birthday's in November. Everybody's Medicare always starts the first of their birth month, okay? I don't get into the exception if you're born on the first of the month, right? Everybody here knows that if you're born on the first of the month, your Medicare starts the first of the previous month. But if they're not born on the first, I'm not going to give them more information just to confuse them. Okay. So your Medicare is going to start November 1st, Charlie. Okay. Here's what I want you to know. Medicare supplements come in all different flavors, Charlie. Just to confuse us even more, Medicare letters them from A through N. The most popular letter is the letter G, and it has been the most popular letter for the last 10 or 12 years. So just to avoid some confusion, we're going to go straight to a letter G. I'm going to explain to you how it all works, how much it all costs. Okay. And they always say yes, no problem. They don't even want to hear about the other letters. Okay. Unless they heard about it from their friends, they're not going to ask you about the other letters. Okay. So we're going to get a quote. Give it a second. Okay, here we go, right? Notices come up. Everything comes up like this with all these numbers exposed, and I just close this out. I don't want them to be confused with anything, right? So I say, look at all these companies here, Charlie. You see all these companies? All these companies are more than willing to sell us a Medicare supplement plan G. But here's what I want you to know. In this Medicare U guidebook again, on page 71, here they start explaining to us what Medicare supplements are all about, what Medigap policies are all about. And right here in the middle of the page, they say that Medigap policies are standardized. What that means is, Charlie, it doesn't matter if you go with Mutual of Omaha, AARP, Blue Cross Blue Shield, or if there was a company on here called Joe's Chicken and Waffles, it doesn't matter. If we went with Joe's Chicken and Waffles, you would get the same benefits from Joe's Chicken and Waffles than you would with Mutual of Omaha, AARP, Blue Cross Blue Shield. They're all going to give us the same benefit. And they usually laugh when I say Joe's Chicken and Waffles, you know, like, damn, there's a company called Joe's Chicken and Waffles. But what you need to know, the only difference you're going to see on here, Charlie, is the price. That's the only thing you're going to see is price. So what I'm supposed to do as your experienced insurance agent is I'm supposed to recommend one for you. Charlie, I'm supposed to say, I recommend this one because it's affordable, it's popular, it has a lot of people on the books, and it's given us great customer service, right? So let me just take a quick glance, and I take a quick glance and I say, listen, okay, out of all these plans, this one would be perfectly okay. This Mutual of Omaha at $131.45 would be perfectly okay. Or this AARP or this Aetna, whatever you guys want to do, be confident in the plan that you select and they'll go with it. This is the one I recommend for you. This one would be perfectly okay. We're going to recommend the ones that are popular and have a lot of people on the books. Because if it's popular and it has a lot of people on the books, imagine if one person gets sick in that pool of people, Charlie. The insurance companies have a much easier time spreading that bill amongst a lot of people than it would a smaller group of people. So that means that the rates of increase over time tend to be less than the rest. Now, we're not fortune tellers. We don't know what the rate increases are going to be later on in the future. We just try to make the best educated guess, you know, up front. So we're going to recommend the Mutual of Omaha. Okay. Now, Charlie, I want to tackle what some people think about at this point. Number one, some people think that we charge money for our services. That's absolutely not true. Me or the next agent down the street are never going to charge money for your services. The way we get paid is we get a paid commission from these insurance companies. Okay, just like your auto insurance agent, just like your home insurance agent, we get a commission from these insurance companies. Okay, so the next myth that people think about when I say that is, well, if we use your services, then that means that all these companies are going to charge us more money because they have to pay you commission. And that's absolutely not true. You can go off to the internet and search all these companies and you'll find the same prices that we're giving you. There's no difference there, right? The last thing that they think about, Charlie, is they say, well, since we're using you, let me see how to word this. Let me see how I word this. Give me a second. So I just had a brain fart. Why am I having a brain fart? Okay.
Because you need more coffee.
I do. I don't even drink coffee, but yeah, I just had a brain fart. I was thinking about something. So
Maybe if you use this provider, they pay you more.
that's exactly where I'm getting at, Lisa. So I appreciate that. So they think, the third myth that they think is that since these insurance companies are paying you, you're only going to offer the insurance companies that pay you, right? That you're only going to offer Mutual of Omaha or AERP or the ones that are paying you. And that's not true. All these carriers that we have on the screen, we have access to them. And you want to use the word access because we may not have an appointment with them, but if you come to us and tell me that you want Capital Life or you want this one or this one, that's the one we're going to go with, right? So those are the three myths that people are thinking about when we're doing these presentations. And every time I say that, they're thankful that we get all that stuff aired out. Okay. So I go back and I tell them, okay, so this is the one I recommend, this Mutual of Omaha. How does it work together with your red, white, and blue card? Okay. Let me give you two examples, Charlie. If God forbid the world came crashing down on us and we had to go through $500,000 worth of cancer treatments, we're going to show the cancer center the red, white, and blue card, and they're going to cover 80% of $500,000. Then right behind it, we're going to show the Medicare supplement card, and that Medicare supplement card with Mutual of Omaha is going to cover the other 20%. The only thing that you're going to be responsible for is the Part B deductible, which is $203. So you're going to be writing a check to the cancer center for $203, and that's it. You're done for the rest of the year. Medicare and your Medicare supplement cover the rest of the cost. Does that make sense, Mr. Charlie? And yeah, absolutely makes sense. Okay. Now that's getting a little dramatic, Charlie, but let's just keep it simple. Let's just say you want to go see the doctor. And if the doctor wants to charge us, $13 for the visit, guess what? We have to pay $13 because we're responsible for the first 203. And let's say we go in another month or two and he wants to charge us $15 for the visit this time. Guess what? We have to pay $15. We have to pay the first $203. If we ever get to that amount, then we're done. We stop losing money. The insurance company covers the rest of the cost. Does that make sense? Right? And then it does make sense, blah, blah, blah. Okay. So Charlie, we just covered, we know two pieces of the puzzle. The third and final piece of the puzzle is our Part D prescription drug plan. Now, it's easy to shop for drug plans if you've done it a couple hundred times like we have. So we go straight to the source, Medicare.gov, plug in the list of your medications, the dosage, how often you take the medications, the pharmacies, and we go through that Part D spiel, okay? I'm not gonna go through the Part D spiel right now. It's for another date because it takes a little while. But okay, so we know the meat and potatoes now of option number one. Red, white, and blue card, 80%, $148.50. Medicare supplement this much. You're responsible for 203. The Part D prescription drug plan, this, and this. Now remember, I told you that Medicare doesn't cover all the extra bells and whistles that people are looking for and that people lose when they're retiring from their employer. So You have to budget. If you want a dental and vision policy, you have to budget for another $65 a month. A good dental and vision policy is going to cost you about $65 a month. Okay. And then if you want the gold standard in Medicare, like most people want, you need to add on a cancer policy. A $30,000 cancer policy is going to cost you roughly around $55 to $60 a month. Now, let me explain to you why everybody needs a cancer policy, right? Number one, and we've talked about this before, right? Number one, what if, don't worry about the cancer bills. They're going to be covered by your Medicare supplement and your Medicare or your Medicare Advantage plan. We just know we have to cover our 20%. But what if the doctor says you need to try out this experimental treatment? Medicare is not going to mess around with that, right? Who's going to help us cover the experimental treatment that's saving people's lives? That's where a big fat check from a cancer policy would help us, right? And then what if the doctor says, I need you to travel to the Cleveland Clinic out in Ohio to get your treatment? Who's going to help you pick up all your stuff, bring support with you, live out there for a month or two, and get your treatment there? Medicare will take care of the bills when you're there if the Cleveland Clinic is in your network. But they're not going to help you pick up all your stuff and bring support with you. A big fat check from a cancer policy would help us, right? And then who's going to help us? A lot of these cancer treatments are going to oral chemo medications. Even though you have a Part D prescription drug plan that we just went over, those medications may still cost us $5,000 or $6,000, $7,000 a year. And if the doctor says, I need you to be on these medications for the next 2 or 3 years, who's going to help us pay for that? That's where a big fat check from a cancer policy would help us. And then the last and final reason, chemotherapy is no joke. It'll bring you to your knees. Cancer surgery is no joke either. Just because you go through one of those things doesn't mean that the next day you're up and running, you're at full strength running marathons. No, you need some time to recover, to get back up to speed. Who's going to help you live the quality of life that you want to live? That's where money from a cancer check would help us do so, right? That is option number one. The gold standard in Medicare, that is option number one, right? So now what I want you to do is I want you to put all that off to the side. Forget about it for a second. Now we're going to talk about option number two, which is called a Medicare Advantage plan, also known as Part C. Charlie, you're probably noticing a lot of commercials on TV now. You're getting a lot of stuff about Medicare in the mail. Most of that stuff is about Medicare Advantage, also known as Part C. Medicare Advantage plans is your Medicare provided to you by private insurance companies. If you decide to jump into a Medicare Advantage plan, you're deciding that you're going to put that red, white, and blue card in a drawer somewhere, and you're going to keep it safe. And you're going to replace it with a Medicare, all-in-one Medicare Advantage card from a private insurance company. When you do that, we now have to follow their rules. And one of their biggest rules is we have to use their networks of doctors and hospitals, okay? It's also more of a pay-as-you-go plan. If you're gonna use the insurance, there's gonna be affordable co-payments for everything, right? If you go see a doctor, it might be $5. If you go see a specialist, it may be 20 or 30. If you get lab work co-payment, if you get x-rays co-payment, 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 co-payment. There's usually just co-payments for all of the major services. But there are 3 services that don't come with a copayment, and that doesn't mean that they're free. The 3 services those 3 services are durable medical equipment, like wheelchairs, oxygen tanks, diabetic supplies, dialysis, if you need to go through dialysis because you have some kidney issues, or lastly, if you need chemotherapy. If we're going through some cancer treatment and you need some chemotherapy, that's when we're paying 20%. We're paying 20% of whatever the cost is until we hit a number. And that number is called the maximum out of pocket, which can be $3,000, $4,000, $5,000, $6,000, who knows? It just depends on the Medicare Advantage plan that we're looking at, okay? So Charlie, I just told you all the bad stuff about Medicare Advantage. I just told you that, you know, private insurance companies, you gotta follow their rules, use their networks of doctors and hospitals, pay co-payments as you go, and there's deductibles and out-of-pockets for certain things, okay? But what's all the good stuff? When you hear the commercials on TV with Joe Namath saying that you can get a Medicare plan with this, 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 and this, and this, and this, and this for $0 a month, they're not lying. He's not lying to us. Most Medicare Advantage plans are $0 a month. You don't have to now. You don't have to pay extra for a Medicare supplement. You don't have to spend $120 on a Medicare supplement because that coverage is already in the Medicare Advantage plan. We just have to pay our part. We just have to pay our co-payments as we go, right? We don't have to pay extra for a drug plan because it's already included in the Medicare Advantage plan. It's an all-in-one Medicare Advantage Part C, okay? And usually you don't have to pay $65 for a dental and vision policy because when they say it comes with all the extra bells and whistles like dental, vision, hearing, gym membership, over-the-counter reimbursement, telemedicine services, usually it comes with all that stuff as well. So you don't have to pay extra for the $65 dental and vision policy, right? But you always still need the cancer policy. The cancer policy is going to come into play with any of the options that you have. Okay. So those are your two primary options, Charlie. You have option number one on the left-hand side, which is a Medicare supplement, and option number two on the right-hand side, which is a Medicare Advantage plan. They're both better options than anything you have now. They're just different ways to go about getting your Medicare. Okay. Now, people will sometimes ask me, Carlos, which one do you recommend? I don't recommend, I don't have a bias towards either one. I wish I had either one of the options myself, okay? The only time I'm gonna make a strong recommendation is if you're already sick, there's already some nasty pre-existing conditions, and you can afford a Medicare supplement, I'm gonna say, let's go with the Medicare supplement. Because we can get it now, no questions asked. They're not gonna ask us any medical questions. But in the future, that may not be the case. We can get it now, but we may not be able to get it in the future if we don't get it now, because right now is what we call open enrollment. 6 months before your Medicare starts or 6 months after, that year window is what we call open enrollment for Medicare supplements. Nobody cares about your health. If you want a Medicare supplement, just fill out an application and they have to give it to us. If you don't go with one now and you want to get one 7 months down the road or 6 months down the road or 3 or 5 years down the road, it's no longer open enrollment. Now we have to fill out an application. We have to answer medical questions. We have to tell them about the medications we're taking. They look into our medical history, and now they have the right to tell us, no, we don't want Charlie. He's already too sick. He's going to cost us too much money. We don't want him part of our club. That's the only time I'm going to give a strong recommendation, right? So that's it. That's the presentation, right? Tell me what your thoughts are. Which one are we leaning towards? And we're trying to make, we're not trying to give them all these options. We're just trying to give them, two options so that they can make an easy decision, A or B, right? Does all this stuff make sense? Does any of this stuff didn't make sense? Do you guys have any questions, or do you guys have any ideas on anything else?
I was thinking if you're gonna do these trainings, that would be great. And if you're gonna do it, I would strongly suggest to go with the final expenses, because I think that's the one that most of my customers ask. I've been referring them to Ernesto, some of them, like the real interested ones, but a lot of them ask for that.
Okay. I don't get a lot of people asking for that kind of stuff. I just tell them what they need, but if people are asking me, yeah, we can talk about final expense. I know a lot of you guys here do a lot of final expense, and next week we can talk about final expense. Somebody wants to jump on board and do some training and show us how to do that stuff, we can. I think I know how to do it, but I'd like to hear from everybody else, because I'm not the pro. I'm not the expert at that.
Carlos,
maybe
for the part
you.
B quoting, and if you go quoting in front of a client, and so you have to collect all their prescription drug, And
Yes.
also, if we go to Medicare.gov, that pop up a lot of carriers, and maybe most of them we are not appointed to. So
Most of them, on the contrary, most of them we are, okay? The way I approach it is, I'm never gonna sell somebody, you know, that has a 3.5 stars, less than 3 stars, right? My excuse is that we're not comfortable with selling less than 3 stars. If that one appears at the top of the list, I'm sorry, I'm not gonna be your agent on that policy, right? If the good one, the best one that appears at the top of the list happens to be someone that I'm not contracted with, I'm gonna say, listen, I recommend this next one because we're comfortable with them. We've had a lot of experience with them. They have great customer service. This is the one I'm gonna recommend, right? And they're always gonna do what I tell them to do. It's not like they're gonna say, no, I want the other one, right? The only time I won't do that to the client, the only time I'll enroll them into the one that I'm not appointed with is if the difference between that one and the one that I am appointed with, if there's a big difference in cost to them, I'm not gonna, I don't want to lose sleep over getting a client something that wasn't the best for them. You see what I'm saying?
yeah.
The $80 is not gonna cost me, is not gonna make or break me. As a matter of fact, I'd rather give up the Part D prescription drug plans if I didn't have to deal with them. I'd rather give up the $80, you know, than having to deal with the Part D prescription drug plan. But that's how I overcome that. They can see exactly what I'm talking about. And if that's the right one for them, then that's the right one for them. If the next one below that doesn't harm them as much and I'm appointed with them, then I'm gonna tell them that I recommend this one because I have experience with them, great customer service. That's the one I recommend. And they never say no. They never say, no, wait, just because you recommend them, I want to go with the other one. You know, they never do that.
How about if the first case you mentioned, so you ask if we are not appointed, so we can ask them to wait for a couple days to get appointed?
Absolutely. If it's something that we have, then great. You know the procedure. Your upline, myself, has to get appointed first, and then you can get appointed, and then we can finally sell the policy. If Premier doesn't have it, then we can go looking somewhere else to get it. If I'm not going to be able to get it, then you can try to get it, direct, or you can just get it direct if you want. If we don't have it on our list and you want to get it direct, then try to get it direct.
Okay.
Does that make sense, Lisa? Like,
Yeah, it makes sense. Since for me, I only have maybe 4 or 5 appointments, company carriers now. So sometimes it pop out like in Part C, MA, PD plan or Part D. Only, yeah, some of them in the top, a couple of them are not in my contracting. So for that case,
I can show you, like last year, all the ones that we had that we got appointed with. So this list right here is all the ones that we had for 2021. Aetna, Alignment Health, Anthem, that's Blue Cross Blue Shield of Kansas, Nebraska, Bright Health, Blue Shield of California, all the Centene, Cigna, Clover, Health Alliance, Humana, Molina, Mutual of Omaha, and United Healthcare. So one of these has to appear at the top of the list.
okay. And for the Kaiser in California, like those 5 stars, so you said we
Yeah.
cannot get appointed. So in that case, we suggest them to looking for a local client if they really want a Kaiser.
If they really want Kaiser, then what I'm doing is I'm enrolling them through Medicare.gov. I'm just helping them do the application right on Medicare.gov.
Oh,
I won't
okay.
get any credit for it, but at least I did right for them. And if they know somebody else that needs some help, they're gonna send them my way.
Okay.
I heard Kaiser is opening up to independent agents, but the Kaiser's on the East Coast, if I'm not mistaken. I think Premier was talking about possibly getting that contract, but we don't know yet. I don't think I know yet.
Thank you so much.
Mhm. Anybody else have any questions about what we talked about?
I have
I had
another
to-
top,
Oh, sorry.
go ahead.
Go ahead.
Oh, I had to jump off because I had a client call.
Okay.
But I didn't I don't know if you talked about it. If not, I'll go back and listen. I was wondering about the dental vision plans because, some members, if they get a supplement, they need, that type of plan. And I don't know who offers it or how do I
Sure.
find that or get
So-
appointed?
So my go-to for dental and vision is United Healthcare. It's just somebody I've been used to, and they're a big name,
Yeah.
But there are other carriers out there. I know a lot of us do, like Ameritas.
Okay. Yeah, yeah.
Cigna is also out there, but I can say that 99% of my clients, I'm putting them on United Healthcare.
If
Right.
I'm already appointed with United Healthcare for the Medicare stuff, does that mean I have to tell them this?
It's a different contract. So yes, we would have to get appointed to do
Okay.
the supplements with them. Not the Medicare supplements, but the under 65 products like the dental, vision, hearing, short-term policies, all that jazz.
Yeah, I need to work on that because I don't think I have those.
Okay. I'm gonna send you a link where I want you to just check off the carriers that you want, and then we'll get you started.
Okay, yeah, because I think Blue Cross is another one that I don't have any of their products either.
Okay, all right, we'll figure that one out too.
Okay, thanks.
Dave, did you have a question?
Yeah, I just had a quick question on the list here that I see. I don't see devoted. We're gonna be adding them on.
Yeah, 100%. You know what? I actually got the request forms for that. So I'm gonna send that out here shortly. I just don't have it on this list because the only ones I put on this list are the ones that I've done the Medicare certifications for.
Got it.
And it's just not on there yet. That was for 2021, but 2022, we're gonna start filling them all up,
Okay, great.
Yeah, devoted is something that we're gonna have for sure. Anybody else? It's 12 o'clock. I don't want to keep anybody. Adalberto, Alejandra, anybody? Got questions for me? If there's anything you guys,
No, I have no questions. Thank you.
okay. Adalberto, you good?
No, I just had a question. This is the first time I've been hearing with the cancer and all that, which was great. But one of the things that I've heard a lot, and I didn't hear you mention much about, was GTL. What's your on that on GTL
I'm like I
for
said,
the hospital?
yeah, I admitted that I'm the worst at the hospital indemnity products, right? I don't sell much of them because I always lead with the cancer policy. That's just me, my fault, right? But I know a lot of us sell GTL and sell Aetna and sell Heartland. We sell a lot of those HIP policies. If somebody wants to next week show us how to sell those policies, man, we're working as a team, right? I'm not the best at everything. I'm pretty good at stuff, but I'm not the best. Together, we are the best. And if somebody wants to step up and do some training on HIP, I'd love to take it. I'd love to do it. So Adalberto, do you do a lot of GTL HIP policies?
No. That's why I'm starting to learn this. So basically, we're brand new at this. So yeah.
I see.
the
So
more-
we're
the
gonna
more-
we're gonna get you going on the HIP policies because I know a lot of folks sell a lot of them. But like I said, I always lead with the cancer policies, but we're gonna get going on the HIP policies too.
That was great too. Okay, thank you.
I hope you learned a lot on the cancer stuff. I'm telling you, all we have to do is present it to the client, and 40% of them are gonna take it. And if we can get 40% out of everything we do, man, that's a lot.
Okay, great.
Yeah.
$300, $400 more a year from the client. That's a lot of money. Okay.
I have a question. When you do the cancer policies, you don't have to specify which type of cancer. Is it just all?
No, I'm not getting into all that like right up front.
Okay.
I'm just telling them, listen, if you're diagnosed with a critical cancer, then we're gonna get a big fat check.
Okay.
And you can use that check to take one last skydiving trip and not pull the chute if you want to. It's your money. Or if you want to use it to pay for the experimental treatment, the displacement traveling, and the medications, then do so. It's your money to do whatever you want with it. But we have to get diagnosed with a critical cancer, then they write us a check.
Okay.
Mhm.
Carlos,
Thank you.
Can
Yeah.
we get some documentation from the Mutual of Omaha about like a list of the cancers or something for some client who may be
Sure.
more?
I'm sure there's an
Picky.
underwriting brochure or a brochure somewhere.
Okay.
And I'll find it and I'll send it in an email.
Okay, thank you.
Okay. Okay, so I'll let everybody go. I appreciate you stopping by. Next week, same thing. We're gonna try to make this consistent and we're gonna talk about stuff that we need to talk about, grow together as a team and hopefully get some special speakers just to talk about their experiences and all that stuff. I was doing this before a long time ago and I just got away from it and I'm promising myself that we got to get back to it. Okay.
Thank you so much. We
Thank
learned
you,
a
sir.
lot.
Okay.
Appreciate it.
I'll talk to you guys later.
Thank
Okay.
you.
Thanks, Carlos.
Thank you.
Thank you.
All right. Bye-bye.